Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform all about the doctors. It is a platform for the doctors, by the doctors, where we discuss the experiences and journeys of successful medical practitioners. And today we have Dr. Varoon Jain. He is an orthodontist and an implant specialist. He is the founder of Smilesutra, a chain of multi-speciality clinics, dental clinics and orthodontic clinics in Mumbai. At the same time, he is also practicing as a consultant orthodontist in UAE since 2016. Very recently, he received a FAMDent award in the special category of orthodontist in the year 2019. So welcome, Dr. Varoon, to The Social Doctor. I'm really glad to have you here. Please tell us a brief about your journey.
Thank you so much, Dr. Ayushi. It's a pleasure being on The Social Doctor. I must acknowledge and appreciate for what you're doing. It's bringing the community together, letting a lot of myths being busted by the doctors for the common people. Also, many a times what happens is many doctors being in respective specialities of their careers, they wouldn't know much about the other specialties. So I think this is a very good way where the doctors would get to know about each other, even if your patients, family, friends, whoever logs in or tunes in. I'm sure that it's going to be a very, very, very beautiful and very valuable insight. I'm sure you're doing a great job. Thank you so much for having me over. I would like to welcome all the viewers, my family, friends, patients, doctors, colleagues, everyone who's tuned in. Thank you so much for coming over.
Yes. So, tell us a bit about yourself. You have had an interesting journey.
Yeah, it's been a great journey so far. It's a learning curve, a steep learning curve. I'm sure everybody in the field is open to learning. As a doctor, we're learning throughout our lives. The journey's been really very eventful. I've been very glad, no complaints. It started post my postgrad in 2012, where I finished up. I had a lot of plans. Truth was stranger than fiction. Always, once you're in your dental school and you're doing a postgrad, you have a lot of aspirations. You have a lot of you have a lot of zeal and fire within you that bahar nikal ke, dunya hasil kar lenge. But then once you step out, you get to know that the life outside the dental college is really, really different. So I had a lot of plans for myself. Plan A did not work. Let's not get there. Plan B did not work. So this was my plan C actually. Smilesutra happened to me as a plan C. I started with my own clinic. Started with 2 clinics initially in the first year. Then we had a 3rd clinic to move on. And things were going pretty fine. And touch wood, by the grace of God, everything was pretty good. And fortunately, there was a holiday that I was on to South Africa, where I was traveling via Dubai, and that's where I met a friend of my dad, where he guided me that why don't I start with my specialty in Dubai, because believe me, it would be very strange for people to believe this, but anything to do abroad for me was never the plan. And I would be really, obliged and thankful to everyone around me and God for sure for allowing me to have all that I have in my life. So UAE was never the plan, and it just happened. His name is Dr. Puri. I would really want to thank him for guiding me through with this. It was that trip of mine, and it's been 4 years now, close to 4 years that I've been practicing in the UAE as a specialist consultant, visiting orthodontist. It's been really good.
Yes, exactly. And it's nice to know that, that at times people around you inspire you to be something that you never planned.
Yes, absolutely.
That's really nice. So now when you're practicing as an orthodontist here as well as UAE, how do you see the future of orthodontist? Because I know the orthodontist is, growing to a different level now, the orthodontic specialty. How do you see the future coming? What do you see different that, the PG people who are actually doing MDS in orthodontist can look forward to, this is something coming? Because I'm sure you might already be seeing all of the recent things, upcoming things coming in the specialty.
So I would say why only orthodontics? The whole dentistry is evolving. There's a lot of evolution in terms of dentistry, and as far as orthodontics is concerned, for all the viewers who don't know what orthodontics is about, orthodontics is a specialty dealing with cosmetics. It's a specialty dealing with diagnosing your, the issues with your. I'm trying to simplify as much as possible for everybody to understand. So it's a specialty dealing with the shape of your teeth, shape of your face, the position of your jaws, and correcting them in order to get good function and good aesthetics. So your teeth only have basic two roles to do. They have function, that's for chewing, speech, and aesthetics for your, everybody is cosmetically oriented now. So that's the major turmoil or the major drift that we've had in dentistry right now. What exactly has started happening is people have started really becoming very conscious. In fact, I would say, pre to this pandemic, I used to always tell everybody that, guys, nowadays, even if you are dealing with somebody who's a far off, vendor or a far off dealer, like suppose if I have a business and I have to deal with somebody who's back in China or if back in any part of the world, I previously, like years from now, where our fathers or like a generation ahead to behind us, like whatever, I mean, like, they would not be really getting in, they will not get to see each other that much. But now, because of Facebook, Instagram, the social media, thanks to people like you who help us get close to each other so much,
Yes.
you really get to see everyone.
Yes.
Like these Zoom meetings has happened so much in this pandemic. You really have got to see someone so close as much as me and you are. We wouldn't
Yes.
have spoken so much. So, I think aesthetics has really played a very important role. How you see yourself on screen, how you see others on screen. So orthodontics is just going to help you enhance that aesthetics. People have become much aware of their aesthetic needs, and their aesthetic demands have increased. So there's a lot of evolution. Orthodontics has also evolved in a way where previously it was a perception that orthodontics is only for the child, not for the adults. It's only for those early teens in the age of 10, 12, 13. But now we have a lot of adults also coming in demanding for a better smile aesthetics, so there's a lot of evolution. We don't have those conventional braces only. Now for people who have that social stigma of not looking good with the braces, we have options of clear aligners where we can offer them the clear alternative where you get to move to your desired smile without even letting the whole world know about it, that you're undergoing treatment. So it's phenomenal, it's really
I know.
great to
I
see,
know.
be a part of a fraternity where you get to transform lives with a smile, and you get to see the change happen.
Yes, I'm sure, you add so much happiness to every patient's smile. I am sure, it adds, it reflects in your smile as well.
Absolutely, it's a any single case which comes to your clinic and has turned out the way you wanted it to, because orthodontics is not an overnight science. When we see a patient, we see the next patient after 3 to 4 weeks a minimum. So after 3 to 4 weeks is that period when we want to see what exactly we have done and has it proved to be fruitful. So any single case that walks in and we see that the change has happened positively how we wanted it to, it makes your day. You're really with that year to year smile and you're happy that fine, you're making the change for the person.
Yes, yes. I completely agree with this. So now when you have been practicing in UAE as well as a consultant orthodontist, so you have already told us how did it happen? How did this come into your, your mind? What are the challenges that now when actually that struck your mind to practice that way by, by Dr. Puri, that he told you to do that? So how did you, what were the challenges? How did you plan to do so?
So basically, other than Dr. Puri was it was a trip with my family, like my with my father-in-law and my wife's side of the family, and Dr. Puri is belonging to medical fraternity. He's not from the dental fraternity, so he could guide me, but then actually couldn't guide me completely. He could let me join the dots a bit, but then couldn't let me really be there completely. So I had to really struggle. It was you were in an alien country where you haven't been in. I was all by myself. I went over there. I started figuring out things back in India. There's they have a process like in UAE, there are different provinces, there are different emirates, and every different emirates has different governing bodies. So these governing bodies have their own respective, authorities which let them practice with a license. It's not like India where you have a dental license under IDA or DCI and you're allowed to practice throughout all the states. In UAE, what happens is, suppose if you want to practice in Dubai, you would be getting a license from the province or the Emirates of Dubai, which is the DHA, which is Dubai Health Authorities. Similarly, you will have different, authorities, like you will have DOH, that is Department of Health for Abu Dhabi, MOH for the rest of the Emirates, which is headquartered in Sharjah. So similarly, you had different things. So it was a lot of confusion at that point in time. I had to do a lot of research and development towards reaching to, a precise, concise, and specifically because I was a specialist, I had a lot of people that I knew who were general dentists who were aspiring to move over there. And there were these Facebook groups, there were these WhatsApp groups, but it was very difficult to know that what was it required for an orthodontist or any specialist to be over there. Orthodontics, I would say, is a specialty that is not very much, oriented to the other side of the dentistry. It's a parallel field altogether. So I was very concerned to know that how are the exams, what are the questions and all of it. It was a little difficult, but I'm glad that there were certain people in my life who came in as, they were my saviors. They were my mentors. Dr. Shias, he was one of the major people who helped me. Dr. Nitin, I'm mentioning them because I am really thankful and indebted to them, because they were the ones who really helped me to guide me to reach to the exact concise a summary towards what exactly will be needed and how it would be taken up forward. So there were a lot of challenges, but
can you just tell in brief what it was for our viewers who are actually thinking to? But yes, in brief, I understand it.
As I told you, the challenges are only about like if people would want to really apply for or would aspire to go to the UAE, first thing they would really want to know is like, how will I get the license to practice over there? So it's like there is, as I told you, there are different provinces have got different requirements. Fortunately, those countries are really very organized, so they have their websites which are very interactive. So you can go onto the websites, you have to make your own account, and there are, over the period of these 4 years, I have seen a lot of agencies also come up which will help you get on, on board. Back in 2016, when I started, there were agencies at that time too, but then I wasn't so
sure. Are these agencies trustworthy? Are these, because I know there are many people who are
so
fake around. So
yeah,
do you know any agency that is trustworthy that we can mention, or do you believe that maximum of them are trustworthy?
No, not really. I would say you really have those naughty ones around everywhere. So
yes.
Sometimes I have really heard about very cruel stories happening from these agencies where they misguide you. Like even when I started, I had very vague offers coming in my email inbox, which when I even because I was over there in the market, when I used to go there and talk to them face to face, I used to realize that it's a fake spam mail which has been sent to many like me. So it does happen that they are misguided. But I would say it's a very basic and easy process. If somebody is busy and is not very much, technologically advanced or sound, they can hire those agencies. Otherwise, it's really, it's a very easy DIY, do it yourself kind of things. You can easily do it. It's just basic requirements that they will be asking you to upload on the sites. Once you upload, there is a verification. After the verification, you will be allowed to appear for an exam. Once you appear for the exam, see, I'm not getting into the details of the examination because every specialty will have details.
And actually, that's very well mentioned on the website. That's fine. I also don't think so. But yes, this is a nice thing that you mentioned, that don't beware of the agencies around. You can easily do it yourself. That as Dr. Varoon has done. That's really nice.
A good reference through which you could end up with an agency. At least you should have somebody who that has gone through that agency and has been successfully employed back in the UAE anywhere. Otherwise, agencies I would not really recommend to go with any of the agencies directly.
Okay. So that's really nice to know that what motivated you and how did you go through this journey. That's so now when you are practicing both places, in Smilesutra in Mumbai and in UAE in multiple centers. What is the difference in practice do you find in both places?
Okay, so
That you think that can be implementable in India, and that can actually add to lives of the dentists here.
see, there's obviously it's a huge geographical difference. It's a huge cultural difference. It's a huge difference in both the countries towards the practice principles. They have a lot of SOPs in place, and they really follow those systematic operational plans. They stick to their steps. Which is really very good about that country. They're very they the good thing about that place is that you really have a lot of value for time, which I feel that has really got me. I've been trying my best to get on to sticking to proper appointments. They are they're very empathetic towards their people. I think that's empathy is one big thing which is very much needed whether you're practicing there or here. So it's like it's see, because as I come from Mumbai, Mumbai you would say is a very cosmopolitan kind of a crowd. You will see all parts of the world, all parts of India coming over here in Mumbai. Some people come for work, some people come for their dreams. Similarly, UAE, Dubai is a place where you would see all parts of the world being cosmopolitized over there. So you have a lot of people, and because of that, you get to know a lot of them across boundaries. You get to learn a lot. It's good to represent Indian orthodontics over there, and it's good to learn from others. It's good to meet everyone. It's been a privilege.
Yes. I completely agree. This would have definitely add to your experiences and your exposures that
Absolutely.
this definitely does. So that's really nice to know that this one thing that you mentioned of sticking to time is very important. I'm sure many of the doctors face that with their patients. This is a very difficult thing that I believe. So nice. So actually yesterday I was discussing with Dr. Varoon about his virtual consultations, and actually I will like him to focus more on it and let our viewers know how does he practice virtual consultations in dentistry, and how does he do that, because he has been doing it from the last 1.5 years now. So can you please tell a bit about it? How are you doing now?
So virtual consults are quite a part of my practice. We have a lot of people across India. This might be surprising, but we'll have a lot of people having inquiries or having their doubts, who would just phone us from, say, any part of the south of India, and they would just want to be sure of what kind of treatment that they would need. So in a virtual consultation, we would be able to help them understand what their problem is. Once they know what their problem is, it's very easy. See, because their perception of their problem could be different at times. They might really misunderstand what their problem is. So at times, a virtual consultation which would help them realize and evaluate what their real problem is, and then we can guide them with the options of the treatments that are available. So at that point in time, with the consultation, that's the bond what you create with your patient at that point in time, where you make the patient sure that the patient is in safe hands. As an orthodontist, we have a lot of patients who are much away from us. Fortunately, the advancements in orthodontics like clear aligners has allowed patients to have treatment even if they're away from their homes, even if they're away from their doctors, even if they're like studying in some other part of the country or other part of the world, and they're undergoing treatment with me over here. It's still possible for us to keep a track of how the patient's treatment is going on. So that's all what is virtual consultations, where we address to patients' chief complaint, and we try and sort them out about what the need of the treatment would be, and we give them options, whatever is possible and whatever they would prefer. So virtual consults really help. I think since last couple of months in this pandemic, the virtual consults have really gone up. But these virtual consults, I would say, would be more need-based. And what we do as virtual consults is more aesthetic-based, But obviously, as long as it is need-based or aesthetic-based, I think virtual consults have really come up way too much now.
No, that's really nice to know, So how do you connect with these patients? As you told me that people call you, How do they get your phone numbers? Do you have through your website, through any of your social media platforms? How do you do
from,
that?
we really have, as like the way you are evolving with socializing with all the people around you. We've also been trying to do our best. We have a presence on mostly all the social platforms. We're there on LinkedIn, we're there on Twitter, we're there on Instagram, we're there on Facebook. So these are ways where people, they try and get in touch with us. We showcase our records, the patient files, the patient before and afters. We showcase our patient testimonials. That's how people get to know about us. That what's the dentistry all about, and that's how they get in touch with us. They would either DM us on Instagram, or they would send us a message on Facebook, or just an inquiry on LinkedIn, and that's how we start to roll the ball from there. That's how it starts, and that's how it goes up further from there. So everybody who's there watching us, they can check us out on Instagram and all other social platforms. We are there with the name Smilesutra. So Smilesutra will be prominently visible everywhere.
So the main crux is that you have to be there online on the social media platforms. If not till now,
absolutely.
If not till now, please get started, because
yes,
things are changing. The audience is changing, the behavior is changing, everything is changing, and this, if you don't evolve, things are not going to get better for you. So you have to go on the social media platforms and evolve and meet your patients there now. That's, I really loved your journey, Dr. Varoon. It's so nice to know everything. So any recommendation for the dentists who are recently passing out and and are planning to establish their own practice in dentistry?
So my recommendation would only be have a set goal, focus. It's I have come across a few sayings in my life which I very fondly believe in, that the word happiness will differ from person to person, and even for the same person from time to time.
Yes.
Happiness would change, but then the definition of success would remain the same. So if you are wishing or willing to be a winner, just focus on your goal. Losers focus on winners. Winners will focus on their goals. So just happen to focus on your goals. Do whatever you want to do, whether it is clinical, whether it is it is non-clinical. It doesn't really matter. As Dr. Ayushi said, yes, having a social presence is very important nowadays. Even if we are wishing to go to a restaurant, we would kind of check for their reviews. So even if it is about a meal, when you go online and you would check for reviews, if it's about your dental treatment, I'm sure people would be more careful about where they are choosing to go. So if you're there present socially, it will be really of great help. Be passionate about what you want to do. I'm sure if you have a goal, you would set it for yourself.
Yes. It's so nice to hear all of this, and especially your quote of, the winners follow their goals and, losers follow winners. So this is something that you should always think and believe in. And so just follow your goal. And I'm sure everyone who does that will achieve it. Thank you so much, Dr. Varoon, for this entire, discussion and telling your journey in so much depth. I'm so glad to have you here.
Thank you so much.
Yes, and I'm sure our viewers will also be, be really happy with all the insight that you mentioned. And I'm sure they're going to share it with their friends and colleagues who find, worth in it and actually help them with all the insights that you have mentioned. So stay tuned with the Social Doctor. We will come up with another interesting interview next Sunday at 11 a.m. with another interesting topic. Thank you so much, Dr. Varoon.
Thank you so much. If any of your audiences, if anybody viewing us needs any advice towards any procedures towards UAE or anything, please feel free to get in touch with me. As I told you, socially we are available. Me and Dr. Ayushi are very glad to have you. Thank you so much.
Yes, exactly. Thank you so much. Bye-bye. Bye.
Bye.